Hello, hi, my name is John, and I'm one of the nurses, registered nurse at Cape Coral Hospital. And then this is my nursing assistant, Jose.
Hello.
So, Jose, how do you prioritize your work, your jobs, when you come in and work?
Well, when I first come in, I make sure all the patients are comfortable. I make sure they have water. If they need to get cleaned up, I'll clean them up. And then usually at that time when I come in, I should set all the patients up for breakfast.
Actually, this is a good thing. So, when I first comes in as a nurse, I will do my report. We're doing bedside report, just making sure everybody's okay. I mean, if the patient isn't anything at the same time, so we can adjust it. But first of all, how I get my way through is asking, hey, do you have any pain? Do you need pain medicine? So pain is very important, and we normally adjust that patient's pain. And as far as like medicine, so I will do my assessment first, get my assessment done, and then I'm give him the medicines, and then I will do our rounding with the patients, just making sure everybody's okay. And then normally I will check with the doctor just to see if they don't need anything throughout the whole day. And seems like that's about it.
Teamwork makes the dream work.
And together we're stronger.
Hello, my name's Alex. I'm a pharmacist here at the Cape Coral Hospital. So the question is, how do I prioritize my day, or how do I triage patients in the morning? Well, when I first get in, I usually print out a list. Here, a physical copy list. It's always nice to have notes and take down. And essentially, you want to find your most sick or the patients that need the attention first. So this is how you prioritize. Generally, we have these medication lists that sort of break down the renal function, the anticoagulation, and the infectious disease processes, and then we sort of triage them from there. We gather up that information if dose adjustments need to be made, if there is a mismatch for the microbiology, so the cultures and the growth that's coming off of it isn't covered by the antibiotic, we need to address those immediately. Anticoagulation, is the dosing correct, is the indication correct? And then at the same time, we also review patients as a whole, so we also look at if they are stroke patients, so we make sure that they are on proper antiplatelets, or if there are certain lab values that may be missing. And as the day goes on, we also receive new medication orders, and as the orders come through, we review them, and at the point of verification is where most of your interventions may occur. Safety is usually paramount.
Prioritizing in healthcare with patients?
Yes.
Okay. So how you prioritize is you pretty much become trained to pick what's most important. So say for instance, you're asked to do 10 things at a time. So you're gonna start for what needs to be done now. This is how I prioritize my day. What needs to be done now, what I need to do by noon or by the end of my shift.
That's a good point, Christina. And you're also going by your most critical patient. The most critical patient, you need to have a good eye on it at the beginning of your shift to be able to prioritize what you're going to do with the patient. And also,
I would say critical lab values come first.
Yes.
So when we get here, we do chart reviews. We check our critical lab values or any critical diagnostic results.
yes, and when you check your vital in the morning, that also will prioritize if you have low blood pressure, high blood pressure, your patient that is on tele, if they have any arrhythmia, new arrhythmia, if you need to call the doctor for any critical labs, as you said. Yeah.
Septic patients come first, and then your sickest patient should come first.
Okay, so what would a septic patient look like?
Sepsis would look low blood pressure, high heart rate, low output or no output,
Some confusion also, altered mental status.
and then a temp,
Okay.
high temp.
Yeah.
Hi, my name is Robert. I work with diabetes education, and the main thing I do is work with people in the hospital to help them better control their blood sugars. I also have a responsibility to help manage people that are in the hospital. So the way I prioritize my day is really the first thing I do is review people that have higher lab values, and I'll look for anything that's truly a critical lab value. Look at their history, see what may need to be done, what adjustments that can be made. contact the provider and have that dealt with right away. Then, of course, follow up during the day and make sure that that situation was resolved. The next thing I do is I look at patients that are getting ready to be discharged and try to address any issues they may have at discharge so that we have a safe discharge and that their needs are met. So when they get home, they can manage their blood sugars well to help avoid problems in the future. And then basically I look at patients that'll need to be seen for education and prioritize according to what their blood sugars are, whether or not their mental state is such that this is what you might consider a teachable moment. And usually by the time I get that list done, it's the end of my day. But that's how I prioritize my day.
Thank you.